Hi, this is Butch Zemar. In this video clip, I'm going to talk about prescription drugs. We're such in a prescription-happy world, and there's a lot of faith and trust in doctors, and I don't want to take anything away from them, but sometimes there's alternatives, ways to save money on your healthcare. One of the problems with the healthcare system is we got away from taking responsibility for our health insurance and deferring it back onto somebody else, and now it's catching up to us. There was a survey done back in 1960 that most Americans were responsible for 48% of their health care. Today, they're responsible for less than 12%. So we're deferring it to try to have somebody else pay for it. We're in a benefit-rich environment. So people got so used to having these prescription copays so low, they gave us incentive for the brand drugs. So the pharmaceutical companies capitalized on it, as we all know now. But even some of the pharmaceutical companies that make the brand drug make their own generic with the same active ingredient underneath the same roof. But there's also other generic alternatives out there that lower your cost of health insurance, as well as how much exposure you have at the time of claim. Nothing beats paying $4 for a prescription drug that used to cost $50 or $60 less, give or take, but it's saving you on your health insurance. There's no reason why you should get a benefit-rich policy so you could pay the insurance company extra money for something you can get for $4. The insurance companies know that, but people are abusing it, so it's driving the cost of health insurance up. But when you're buying your own private insurance, things change because insurance companies are now deferring it back to you, so that way you're responsible for the insurance, well, or the benefit. But the insurance companies are getting smart. If you have a low enough deductible, they're going to charge you more in premium because of the lower deductible, but they're going to add a prescription copay plan. But it's expensive. If you go with a high enough deductible, they take the copay plan out of the copay is out of the plan anyways. And other carriers, they charge additional premium to have a prescription card benefit. But when you look at the total picture of what it costs to add prescriptions, it could cost as much or more of 25% of the total base premium. It's expensive, but if you're not on everyday medications, one, it's not worth it. You can get a generic drug for an alternative medication and get it for $4 at Walmart or even Walgreens. So it's a lot less expensive, and you're paying additional premiums. Some of the programs out there have what I call a cost-sharing method, which means that you pay additional premiums to have the benefit in your plan. You still have to meet a separate deductible, usually 100, 200, whatever it might be, and then they only share the cost with you. It's not 100%, and it works out. It saves you a lot of money. But here's the deal: if you're paying that much money for a cost-sharing benefit, plus you're still going to pay 30% or 50% of the whole drug anyways, so you could find an alternative way to actually reduce your healthcare costs and your prescription drugs by just finding something alternative. Your doctor has an incentive to get you to keep coming back every few months so that he could pay for his own bills. He's in business. They're in sales just like everybody else is. They need you to come back so that they have continuous business. If they don't prescribe you medication that needs ongoing treatment, what is he there for, or she there for? So they need you to come back. So that's one reason why they prescribe all these drugs, where you can go out in the marketplace and get generic drugs that cost less. You don't need to go to see the doctor as often. There's other supplemental programs, and it could be as easy as changing your diet or adding something to your diet that you don't need to take that prescription drug. And this will reduce your healthcare cost and make things a lot more affordable. You become a little bit wiser. You'll ask your doctor, do I really need to take this medication? Why am I taking it? Is there something else I could do before I could take it? Otherwise, it will cost you a lot of money. So this is just another tip to help reduce your healthcare expenses.